You never have to second guess when to schedule your next checkup.
Really? I guess Dr. Steve has the reason why. Hi, Dr. Steve.
That's right,
Did we do that all right?
Yeah, that was awesome, I got to tell you. All right, so mammograms, colonoscopies, dental exams. When should you schedule these tests and how often? Well, joining me now is Dr. Keri Peterson. She's the Women's Health Contributor, and she's here to take all the guesswork out of all that. Dr. Keri, good to see you.
Good morning. Great to be here.
All right, so we have all this list, right? We've broken down like how often to come for certain things because it can be overwhelming, but that's why you have to have a good primary care doctor, right?
That's right.
Okay,
that's right.
But once a month, what should people do, should be thinking of, should be checking for?
So once a month, all women should do a self-breast exam, and they should do it just after their period, the same time each month, feeling for any lumps or bumps. What you should also do is a self-skin exam, looking for any changes in marks, and the acronym that we use to look for is A, B, C, D, E. A for asymmetry, B for irregular borders, C for uneven color, D for a diameter larger than an eraser of a pencil, and E for any evolving size and shape.
Right, so anything that looks like it's changing. Hey, this mole looks different, it's changing. Okay, what about once a year? I'm sorry, once every 6 months?
Every 6 months, get your teeth cleaned. People tend to be neglectful of their teeth, but go to the dentist twice a year for cleaning.
Okay, so get to that dentist. Yes. Besides, it's good for us too. Those are people talking real close to you. All right, once a year, you say a full physical.
A full physical once a year, that's a great opportunity for you to give your doctor your health habits, get updated on what preventative screenings you need, make sure your vaccines are up to date, get any blood tests that are needed. So please make a physical every year.
Once a year, and also GYN-wise, you're talking Pap and pelvic and mammogram.
That's correct. So for a Pap smear, it should be every year, but if you've had 3 normal in a row and you're in a monogamous relationship, you can go up to every 3 years instead. But that mammogram starting at age 40 every year, and you really still should see your gynecologist for a pelvic exam every year as well.
Okay, and now additionally, HIV and other STDs, good idea to get checked?
You should, if you have any risk factors for HIV, get checked every year. And for women under the age of 25 who are sexually active, they should be screened for STDs as well regularly. And then after 25, if they've had risky behavior.
Okay, now you talked about skin earlier, but there's also every other year for skin.
That's correct. Every other year you should go to a dermatologist, a professional, to do a full exam, head to toe. They look in your scalp, behind your ears, every nook and cranny, and then they biopsy anything if it looks irregular.
Yeah, and we should emphasize it's every nook and cranny, like underwear off everything.
Yes.
Don't be bashful. Okay, slightly less often, cholesterol, triglycerides, thyroid test.
Thyroid testing, that should be done for all women after age 35, and it should be done every 5 years. And that's just to look to see if your thyroid's underactive, if it's not functioning properly. And for cholesterol screening, the recommendations are based on what risk factors you have. If you have a family history, if you have other things like high blood pressure, you should get your cholesterol started screening if you have no risk factors at age 35 for men and 45 for women.
All right, Dr. Keri Peterson, thanks so much for coming in. Really appreciate it. Guys, back over to you.